Andrew, half the Boron videos promise a free testosterone leap from a cheap capsule. If someone already eats fruit, nuts, and legumes, is that pill a real hormone strategy for everyday adults? Or are creators selling a blood marker story as if it were a clinical win for muscles, mood, and sex drive?
Boron is a dietary trace mineral people absorb mainly from plant foods. Think dried fruit, avocados, nuts, legumes, and from some drinking water. In physiology, it shows up beside mineral metabolism, meaning how calcium, magnesium, and related handling work. Not as a steroid-like drug that rewrites your endocrine set point overnight. The honest first frame is ordinary dietary exposure and mineral pathways, not a guaranteed androgen bump from a bottle marketed beside gym hormones. Inside the gut and bloodstream, boron behaves more like a supporting mineral signal than hormone replacement. Creators often leap from that supporting role straight to testosterone surges or osteoporosis cures, and that leap is where mechanism talk outruns outcome data. Viewers deserve the quieter version, possible mineral roles, uncertain clinical size, and no automatic place on the hormone podium. Keep the podium empty until outcomes fill it.
Then why do bone health channels park boron next to calcium and vitamin D like it is already a proven third pillar for densitometry, fracture prevention, and long-term skeleton maintenance?
Because small human studies sometimes report biomarker shifts, steroid-binding proteins or mineral markers, and those get narrated as fracture reduction or hormone restoration. A marker can move without changing pain, densitometry trajectory, sexual function, or training performance. That biomarker to outcome gap is exactly where boron marketing overreaches the peer-reviewed record we can actually defend for everyday viewers comparing supplement aisles.
So if plasma boron can rise while the outcome people care about stays flat, why do supplement labels and thumbnails still treat a lab tick like proof of real-world benefit?
Look at a concrete 2024 secondary analysis from a multi-nutrient ADHD trial in children. Plasma boron rose more with multi-nutrients than placebo after 8 weeks, along with several other minerals. Yet those mineral changes did not mediate who became a behavioral responder. Higher circulating boron was measured, and it still was not the clinical mechanism of improvement. That is a clean teaching case for evidence compression on this mineral. Blood up, mediation absent. After extracorporeal shockwave lithotripsy, a randomized trial compared boron supplement with tamsulosin for fragment passage. Clearance time and pain looked similar across short follow-up, and boron did not earn a clear superiority story over the standard alpha blocker pathway. Surgery-adjacent data like that can be interesting for stone clinics without underwriting testosterone, erectile dysfunction, or osteoporosis hype from fitness media thumbnails.
Before we chase specialty headlines from wound gels or animal papers, who should hesitate on concentrated oral boron? Pregnancy, kidney disease, people stacking high-milligram capsules for hormones, or anyone already on a crowded medication list heading toward a procedure?
Separately, a randomized trial of topical sodium, pentaborate gel, and diabetic foot ulcers reported larger Wagner grade improvements and higher healing rates than a conventional topical control, with less short-term recurrence in that cohort. Local wound chemistry and cell migration effects at the skin are not an oral hormone protocol. Do not translate a gel finding into a testosterone or bone capsule, even if both products mention boron on the front label in bold.
Fitness channels also wave rodent weight loss meta-analyses around beside gym testosterone claims. Do animal boron studies give adults a green light for fat loss stacks? Or is that another category error between species, dose forms, and human endpoints?
A 2022 meta-analysis of rodent studies found lower body weight with oral boron compounds, especially in shorter protocols and borax forms, with larger signals in male animals, and the authors explicitly said human clinical trials are still needed. Energy metabolism, thermogenesis, and lipolysis signals in rodents are hypotheses. They are not a validated obesity therapy, and they say nothing reliable about free testosterone for adult gym marketing. Keep species lanes separate. NCCIH consumer guidance still fits this mineral perfectly. Evidence quality varies widely across supplements. Retail products may differ from study products, and concentrated intakes can interact with medicines or matter around surgery. Food boron from produce and legumes is a different exposure class than high-dose capsules bought to chase hormones. FDA-style supplement basics also remind us products are not pre-proven, like prescription drugs before sale the way drugs are.
If someone is pregnant, managing diabetic ulcers, or already on hormone therapy, what is the clinician boundary instead of self-dosing from a thumbnail that mixes wound gels, animal fat loss papers, and androgen claims into one bottle?
Judge help by the endpoint you actually booked care for: stone follow-up imaging, wound grade under an ulcer team, densitometry and fall risk plans, symptom scores, not by whether a boron blood value twitched after a multinutrient. Small COVID-era boron citrate pilots in mineral multinutrient work can move labs or short respiratory symptoms without proving long-term bone strength or androgen benefits in healthy adults shopping online for capsules. Booked endpoints beat bottle hope. Keep high-dose oral boron out of DIY hormone or osteoporosis stacks unless a clinician who knows the full medication list, kidney status, and pregnancy plans is involved from the start. Wound gels belong inside diabetic ulcer pathways, not bathroom cabinets used as testosterone hacks. High exposure also raises toxicity and reproductive caution that ordinary food portions do not automatically create for home experimenters copying video protocols. Practical close for viewers. Build ordinary boron from food patterns first. Treat oral capsules as weekly supported for the loudest bone and hormone promises online. And let peer-reviewed outcomes, not influencer certainty, set how much hope, money, and stacking you attach to this trace mineral before the next viral clip lands in your feed. Quiet food beats loud capsules.